The National Health Council is an umbrella organization, and our core groups are, in fact, patient advocacy organizations. And so our mission is to provide a united voice for people with chronic diseases and disabilities. And we work on issues that are important to all of them. One of the most important issues, as you can imagine, is having the right access to the right health care for that individual. And we believe that by having that right care for them as an individual, their health outcomes will be better and we will ultimately save money. I think it's important to engage patients in research from the very beginning so that they can even help design and decide what the research questions will be. I think what we all know is that patients know best what outcomes are important to them in their lives as patients with that particular chronic condition. So if the research questions include those outcomes that patients notice and they care about, ultimately that research will be much better and it will have the sort of buy-in of patients, and therefore, again, we will really have better health outcomes based on that types of research with their input than we would otherwise. I think it's our responsibility to really understand whether it's clinical effectiveness research or basic research or clinical designs. We need to understand that well so that we can then turn and explain it in a way that's understandable to patients, and most importantly, bring them from what we call confusion to understanding to action so that they can then play a meaningful role in the entire research enterprise.